Hey guys, welcome back to my YouTube channel. Hope you guys are doing great. Okay, for those of you who are wondering who I am or what this YouTube channel is all about, I am Ame Boris, a nurse midwife by profession, and I work in a maternity setting where I get to deal with obstetric emergencies every day. Obstetric emergencies are simply health-related problems that are life-threatening for both a pregnant woman and her baby. So this is why I decided to start this YouTube channel where I can share my knowledge and experiences with the world, educate women of reproductive age, families, in order to maximize the health of a pregnant woman during pregnancy, labor, and delivery. So if you're interested in my content or in my YouTube channel, please subscribe and turn on the bell icon so you won't miss any of my upcoming videos. Okay, in today's episode, I'll be talking about an ectopic pregnancy, and this is an example of an obstetric emergency. So I'll be telling you all those factors that can put a woman of reproductive age at the risk of having an ectopic pregnancy. I'll be talking about the symptoms of an ectopic pregnancy, and I'll be telling you all how to prevent an ectopic pregnancy. So if you don't want to miss any part of this video, please watch to the end. Okay, what is an ectopic pregnancy? An ectopic pregnancy simply occurs when a fertilized egg implants itself out of the uterus. This fertilized egg can either be implanted in the ovary, in the abdomen, or in the fallopian tube. When this occurs in the fallopian tube, this type of ectopic pregnancy is called a tubal pregnancy. And it's very important for you to be aware that during an ectopic pregnancy, a woman will still exhibit the early signs of a normal pregnancy. That she will still experience amenorrhea, which is cessation of her menses. And when a pregnancy test is being done, the test will be positive. This is because during an ectopic pregnancy, HCG levels are also being emitted. That's the human chorionic gonadotropin is present during an ectopic pregnancy. But the difference is during an ectopic pregnancy, the HCG levels will be lower. So this is something that can keep a health personnel alert or a pregnant woman alert. This might give them a hint that they might have an ectopic pregnancy. And another way to diagnose an ectopic pregnancy is through a pelvic exam or through an ultrasound. So these are some of the ways to diagnose an ectopic pregnancy. Okay, now let's move to some of those factors that can put a pregnant woman at risk of having an ectopic pregnancy. The first factor that will put a pregnant woman at risk of having an ectopic pregnancy is sexually transmitted infections, particularly gonorrhea and chlamydia. These infections can put a pregnant woman at risk of having an ectopic pregnancy if particularly these infections have been left untreated, because this may eventually lead to pelvic inflammatory disease. And it is pelvic inflammatory disease that causes the growth of bacteria into the reproductive organs, like the fallopian tube, for example. This will cause inflammation in those fallopian tubes or scarring in the fallopian tube. So it will make it very difficult for the fertilized egg to pass through the fallopian tube and into the uterus. So the fertilized egg may end up in the fallopian tube, thereby developing into an embryo. So this is a risk factor. So women who are planning to conceive need to get screened for chlamydia, gonorrhea, and the pelvic inflammatory disease, because this can put them at risk of having an ectopic pregnancy. And the second factor that can also put a pregnant woman at risk of having an ectopic pregnancy is a tubal surgery. That's pregnant women who have previously underwent a surgery that was related to the fallopian tubes. That's women who underwent a surgery because they had blocked fallopian tubes, or women who underwent a surgery because they wanted to tie both their fallopian tubes. This can put them at risk of having an ectopic pregnancy. And the third factor that can also put women of reproductive age to have an ectopic pregnancy that can also put them at risk is endometriosis. Endometriosis is when one of the layers of the uterus, that's the endometrium, grows outside the uterus. That's, it can grow on the fallopian tubes, or it can grow on the abdomen or the intestines. And when this grows on the fallopian tube, there is some hindrance to that fertilized egg. So this may make the fertilized egg to implant itself in the fallopian tube, thereby leading to a tubal pregnancy or an ectopic pregnancy. And the fourth factor that can also put women of reproductive age at risk of ectopic pregnancy is a history of previous ectopic pregnancies. Research has shown that there is a 15% chance that women who have previously had an ectopic pregnancy can still have it in their next pregnancies. So these are the factors that women of reproductive age need to be aware about. Now, heading to the symptoms of an ectopic pregnancy, I'll be telling you all the symptoms of a non-ruptured ectopic pregnancy and the symptoms of a ruptured ectopic pregnancy. Okay, let's talk about the symptoms of a non-ruptured ectopic pregnancy. The most common symptoms of a non-ruptured ectopic pregnancy, from my experience, is pelvic pain and light pervaginal bleeding. This is the most common symptom, and these symptoms often occur as early as 5 to 7 weeks of pregnancy. And since an ectopic pregnancy occurs out of the uterus, the baby cannot really develop properly because the baby cannot be accommodated by the fallopian tube or the abdomen. So eventually, the ectopic pregnancy will rupture at some point. Ectopic pregnancies typically last only within the first trimester of pregnancy. That's within the first 3 months. They cannot go further than that because at some point, ectopic pregnancies will rupture. And this is one of the reasons why an ectopic pregnancy is considered an obstetric emergency, because it's life-threatening. So the symptoms of an ectopic pregnancy, the first common symptom of a ruptured ectopic pregnancy is fainting. And the woman can also have dizziness or severe abdominal tenderness, and she can also have bleeding, but maybe sometimes there's no bleeding, and there's also shoulder pain and extreme fatigue. So these are the common symptoms of a ruptured ectopic pregnancy. At times, the pregnant woman may also experience vomiting. These are signs to show that the ectopic pregnancy has ruptured. Like I always tell people in my channel, that prevention will always be the best. Prevention will always be better than cure. So I'll be telling you some of those ways that you can prevent an ectopic pregnancy. The first way in order to prevent an ectopic pregnancy is that you need to avoid multiple sex partners. Why is this so? This is because it will help reduce your risk of having sexually transmitted infections like chlamydia or gonorrhea. Because like I said before, these infections can cause pelvic inflammatory disease. And pelvic inflammatory disease is what causes the scarring and inflammation in your fallopian tubes. So this makes it very difficult for that fertilized eggs to pass through that tubes and into the womb. So women who are trying to get pregnant, if they want to avoid an ectopic pregnancy, then they need to avoid multiple sex partners, or do your best to practice safe sex. The second factor that can help you also to avoid an ectopic pregnancy is that you need to avoid douching. Douching simply means introducing chemicals like detergents or soaps into your vagina with the aim of cleaning it. This is not good because those detergents and soaps, they instead destroy that normal vaginal bacteria, and it will keep your vagina vulnerable to infections. So it is very important for you to avoid douching, because this will also cause the growth of bacteria which might cause an inflammation in those fallopian tubes. So it is very important for you to be aware about this douching. Douching is not recommended for women of reproductive age. And the third factor that can also help you to prevent an ectopic pregnancy is that you need to avoid smoking. Research has shown that women who smoke before pregnancy, before conceiving, have a higher risk of having an ectopic pregnancy than women who don't smoke at all. Because it's important for you to know that there is no amount of cigarette that is required for you to take before you conceive or during pregnancy. So these are some of the things you need to be aware about. Shortly, a link is going to pop up on the screen. It's one of my videos on the things you need to be aware about before you conceive. So you can click that link on the screen and watch that video. It will keep you aware of the things you need to be aware about before you conceive. So guys, I hope this video was helpful. Please comment down below and tell me what you think. And don't forget to like this video, share it, subscribe, and turn on the bell icon so you won't miss any of my upcoming videos. This has been Boris the Midwife. Your health is my priority. Jesus Christ loves you all. Stay blessed and see you in my next video.